I'm Simon Ash, trained as a dentist. I've been a consultant orthodontist in East London most of my career, and very fortunately been working with chest physicians, ENT, the range of specialties that you would expect to find in secondary care. I got into this area having been dragged kicking and screaming by a consultant in chest medicine who'd found out about mandibular advancement appliances, and was particularly, his special interest was sleep medicine, and he felt that there was a place for mandibular advancement appliances and what I'd been doing. I first started working on the Somnowell about 14 years ago, being fairly dissatisfied with the other appliances that were out there, predominantly made of plastic and thermoplastics, since I realised that the problems that both I had with some snoring and a little bit of tooth grinding and so on were not going to go away. And this is common in people as we get older. We don't stop snoring. If anything, the problem gets worse. And I realised that it's no good giving patients something that was not going to last. There are just too many patients out there. We've got to find a more robust long-term solution. So I then looked at other materials, and the obvious one that came to me was the use of chrome cobalt. The advantage of chrome cobalt is it's very strong in thin section. So it's a metal, and a very, very strong metal. So it means you can make it rather like mouth jewellery. It can be very, very thin, tailor-made to the individual patient's mouth without the bulk, but with the strength. And therefore patients like it, it's comfortable. So the jaw is held forward, cradled by the appliance, so that they can actually wear this very comfortably in bed at night without little intrusion into tongue space. And it really is like a wedding ring. It's really comfortable once you get used to them. Because it's so easy to wear, because it's so comfortable, patients wear them. And if they wear them, they seem to work.
Somnowell project is one that really interests me because I've found great results on my patients. And I see my role really as excluding any comorbidity. So I'm looking at more severe forms of snoring. I'm looking at very blocked noses with loss of smell. I'm looking at tumours of the throat. I'm looking at bad tonsillitis. I'm looking at other things that may be associated with snoring. And of course, sleep apnea as well, which needs to be excluded in all cases. What I found in my patients, and I treat a large number of snoring patients every year, is that there's a pretty much 100% efficacy with Somnowell once the patient tolerates it and has any other treatments required. Once it's fitted, it seems to work pretty much all the time.
When a patient comes to meet me on the first visit, we do an initial consultation, and that usually takes the form of a history, medical history, dental history, a full examination of the face, the jaw, inside the mouth, the teeth and so on. So we do all that. We then take very exact records, and these take the form of very accurate impressions of the upper and the lower jaw. We then take a postured bite, because what we want to do is bring that lower jaw forward, simulating what the appliance will do. We bring the jaw forward, holding the jaw forward with some wax or silicone between the teeth, making sure that the jaw joints are comfortable in that position, and holding the jaw forward. And actually, while we're doing that, we can test whether the airway is a bit clearer, and we can just check that it's not causing the patient any jaw discomfort. So we do that. And then the third thing, which is absolutely, we believe, to be unique to the Somnowell production, is that we take a Facebook recording, which is a recording of how the upper jaw, or the model of the upper jaw, relates to the ears and the skull, so that we can get a better understanding of how the temporomandibular joints are working, and the joints that the appliance has in the mouth itself. The Somnowell has 4 joints, if you like, and the TM joints are 2, so you need those 6 joints all working in harmony, so that when the appliance is constructed, we put it on a jaw simulator at each stage, so that we try and simulate what the jaw is actually doing for maximum comfort for the patient. Unlike many plastic devices that I have tried, which have a limited life expectancy based on the material, which is plastic, and these materials degrade or fail, chrome cobalt is a cast metal. So providing you look after your mouth and your teeth, they should last fairly indefinitely. I've been using chrome cobalt for the last 14, 15 years. 1 or 2 patients come back with a breakage, but they seem to be going on and on and on. So if you look after your mouth and the appliance, they should last fairly indefinitely. We have been doing follow-up surveys on our patients almost ever since I started. And I suppose we've got probably something like 300 follow-up surveys for patients where they've told us how they've got on, both short-term and long-term. And looking at those in the long term and then analysing the results, we're getting something like a 93% success rate for the conditions that patients are complaining of. Not everybody says it sorts them out perfectly. There's obviously a range, but on the whole, that's the sort of level.
I'm Sharif Habashi. I'm a consultant ear, nose and throat surgeon. I have been working in North London for about 19 years. I decided to try the Somnowell device myself, and I thought it would be my Christmas present to my wife. I decided not to tell her anything about it until I'd actually had the device fitted, and I slept with it in for one night without saying anything to my wife. And then the next night, same thing, I slept with the device in, and then in the morning I asked her if she'd noticed any difference. And she said yes. For the first time that she could remember, she had been woken for those 2 mornings by the alarm clock. And she'd realised that actually she could sleep through the whole night. She had thought that she was, a poor sleeper now because she was getting older, but she now realised it was my snoring. And at first she was delighted, and then she was actually quite cross that she'd had to put up with that for so many years. But then very quickly she was very happy again.